Good morning, good afternoon, good evening, friends, colleagues. Welcome to the webinar on combating inequalities, what role for universal social protection. My name is Shahra Razavi. I'm the director of the Universal Social Protection Department at the International Labour Organization, ILO. And I'm very happy to have the privilege of moderating the panel today, focusing on this theme of inequalities and the role of social protection in combating inequalities. The webinar's aim really is to foster a discussion around this theme of universal social protection, its financing, modes of expenditure, and how it can impact on inequalities. This is a theme that is very high on the global agenda in the negotiations of the 4th International Conference on Financing for Development, have already reaffirmed the commitment to reducing inequalities both within and among countries, and emphasizing the need for policies that can really reverse this trend of rising inequalities. And we can also see already that this is going to be another major issue on the agenda of the Second World Summit for Social Development as well. The basis and the backdrop to this webinar is the new ILO working paper that I have co-authored with some of my colleagues who are going to be speaking and presenting the paper today to you on exactly that theme of inequalities and the role of social protection systems in reducing them. I'm also going to give you a few kind of tips about what we will be doing today. First of all, the first note for you to take pay attention to is that the session is being recorded, and along with this presentation, it will be available on the socialprotection.org, and it will be sent to everyone who has registered for this session. Secondly, very importantly, please make use of the chat box if you want to just present yourselves, make comments or share a useful link. But very importantly, when we come to questions and answers, and there will be time for Q&A, please share your questions through the Q&A box and not in the chat box. Make sure that when you pose your question, you include your name and institutional affiliation. And if your question is specifically directed at one of the panelists, please do say so that they can pick up the question. So with these kind of few essentials, I'm just going to say very briefly that we're going to start with about 10 minutes of introductory statements that I'm going to kind of give as background to the webinar. And then we will have our presentations, which we hope will not take more than 50 minutes, giving us 20 minutes to pick up on the questions in the Q&A box and get responses to them. And then very briefly, we will wrap up at the end in 5 minutes. With that, it's my great privilege to introduce you to our panelists today. I have Sudhvir Singh here with us, who's the unit head of the Equity and Health Unit in the World Health Organization. Also very happy to be welcoming Katja Hujo, who's the head of the Bonn office and also senior research coordinator at the United Nations Research Institute for Social Development. And then my two colleagues, Helmut Schwarzer, who's the head of the Public Finance, Actuarial Services and Statistics Unit in my department, the Department of Universal Social Protection at the ILO. And also, last but not least, my colleague Umberto Cattaneo, who is the Public Finance Specialist, also in the PFACTS unit of our department at the ILO. So with that, I will start with a few really opening remarks to locate the discussion that we will be having in its broader context. Now, many of you will, of course, recall that this whole issue of income inequality was missing from the development agenda during the neoliberal kind of era, and particularly, I should say, the high neoliberal era of the 1980s and 90s. And this was also reflected in the MDGs, which did not make a reference to income inequality. This omission, I think, really highlighted a gap that we had in the global development agenda at the time. Now, when inequality started re-emerging on the global policy agenda beginning in the 2000s, the initial response from mainstream policy institutions was to sort of say that we need to focus on what is called equality of opportunity, rather than worry too much about income inequality or wealth inequality, what is often referred to as equality of outcome. You know, that this kind of was getting into what they called a politics of envy. However, I think given the interconnections between the two, between equality of opportunity and outcome, a very important point that the late economist Tony Atkinson made, which has become an adage, is that if we are concerned about equality of opportunity tomorrow, we need to be concerned about inequality of outcome today. And this resonated, I think, quite widely in that period. So despite the greater attention that has been paid to inequality and the fact that it was included as a goal in the 2030 agenda, goal 10, even if it was subsequently subverted by the choice of target and indicator, the overall levels of inequality in the world persist at alarmingly high rates. The statistics is out there. Maybe just one point to highlight is that the portion of total income that is held by households in the lower 50th percentile is 25%, compared to the 30% that is held by those who are within the top 30% or 10% or the 90th percentile. So quite a speaking statistic there. And the high level of income inequality that we see today, we know is driven by the fact that the change in rhetoric that we have seen with the recognition of inequality as something that is problematic has not really been accompanied by a commensurate transformation of the policy agenda, particularly of social policies, but also of economic and including macroeconomic policies. Now, looking at the share of total income that is attributed to labor earnings, the labor share of income, which is around 43.8% in 2022. There is stagnation there, and this really hinders the reduction of income inequalities and constrains the ability of governments to also generate revenues through social security contributions. So reducing the inequality between labor and capital, what is sometimes called the functional distribution of income or primary distribution, is therefore essential if countries are really to be able to reduce the overall levels of inequality that they experience, including in terms of intergenerational social mobility. In addition, we also know that labor market informality, which unfortunately remains extensive in many parts of the world, exacerbates these income inequalities and restrains the access to social insurance for workers who lack sufficient contributory capacity. Also, another vice that comes with this is this low intergenerational social mobility, which reinforces inequalities. And we also know that countries that have high levels of income inequality also tend to have very low levels of intergenerational mobility. Wealth inequalities have also been highlighted, and this is absolutely key, including in many high-income countries, and they also tend to reinforce and exacerbate income inequalities. Now, we all know that income inequalities are bad for societies. There's been a lot of research on the the adverse social outcomes because it weakens social cohesion. It leads to very poor health outcomes, something that I'm sure Sudhvir will be picking up on, but also because we also know that high income inequality reduces economic growth. So it also has an impact on economic dynamism. Limiting access to education opportunities for a large part of the population, we know, is something which hurts economic dynamism and structural transformation of the economy in the medium to long term. Inequality, we also know, is toxic due to its tendency to trigger crises, including financial meltdowns, as well as the potential that it has to subvert the kind of regulatory and accountability institutions, and also the quality of democracy. And these are issues that I think were beautifully articulated in UNRISD's very powerful 2022 report on crises of inequality that I hope Katja will be picking up on and elaborating for us. Despite this, I think for a long time, the kind of mainstream economic thinking, which saw a trade-off between equality and growth, has tended to dominate sort of policy thinking and how governments see the issues worldwide. And this really has played a critical role in creating today's high levels of income inequality that we see. Even if the alleged trade-off between equality and growth is not actually supported by empirical evidence. And we had some good pieces of research coming out of the IMF that really did hone in on this point to say that inequality is actually not good for economic dynamism and growth. And we also know that countries with high levels of income inequality are also those that are doing relatively poorly when it comes to GDP per capita. So how are we to eliminate and to reduce income inequalities today? Looking again at three factors that have led to today's high levels of income inequality. One is the stagnation of labor income share. The other is low intergenerational social mobility, and the other is widening wealth inequalities. And we know that to really be able to address these big challenges, investments in social protection emerge as a powerful tool. They have an important role to play. And new ILO evidence shows that high social protection expenditure is actually associated with lower levels of income inequality. This is something that I hope Helmut will pick up on from the paper that we've just published and elaborate for you in the presentation. And the positive impacts of social protection systems in reducing income inequality operate both vertical inequality, but also horizontally, explored in our paper in terms of gender inequalities, reinforcing the case for establishing and sustaining universal social protection systems based on the core principles that are laid out in international social security standards, which require attention both on the expenditure side, what money and resources in social protection are being invested in, and also on the financing side, how the resources are mobilized in order to build social protection systems, a very important area that I hope, I'm sure Umberto will address in his presentation. However, I think it's also really important to emphasize that reducing income inequalities cannot be left to social protection systems alone. It requires a wide range of integrated public policies, including access to quality education, skills training, labor protection, very importantly, including wage policies, also formalization strategies, and macroeconomic policies that are geared to creating employment and livelihoods, as well as adequate investments in quality public services. All of this to really also be able to address this problem of reducing the primary distribution of income and making labor markets more equitable. Now, looking forward, I think it's really encouraging that in the zero draft of the FFD, in the Financing for Development outcome document, there is an acknowledgement in this first draft that has just come out of the need to take action to address inequalities within countries as well as among countries, and to pursue policies that can really stem this tide of rising inequality. There's a reference to it in the outcome document, paragraph 13, and we hope that this will also become a very powerful coalition. We could create a powerful coalition, bringing the issue of inequality to the center of the discussions leading to the Second World Summit for Social Development. This is certainly a priority for the ILO, and I'm sure that for our partners who are taking part in the webinar today, WHO and UNRISD, it's also a key issue that we all hope we can take to Doha and have it elaborated in the declaration that emerges from Doha. So let us now quickly move to our panel, which I know you've all been waiting to hear from. So enough from me at this point. I'm going to start with Katja first, if I can go to Katja first, and ask again about this. I just referred to the Second World Summit for Social Development. Now, in your view, Katja, what are the issues that in this Second World Summit for Social Development we really cannot afford to miss? What are the issues, and how can we ensure that the whole issue of inequalities is brought to the agenda and properly addressed, and therefore hopefully mitigated? I leave you that question, and thank you for taking the floor now.
Thank you very much, Shahra. It's a pleasure to be here. Thank you also to socialprotection.org for hosting the seminar. I will present some slides to answer your question, Shahra. So let me just share my screen. Okay, so yeah, to answer your question, I want to really make a strong case for harnessing social protection and fiscal policy, as you said, you know, the two sides of the coin, the state investment, the expenditure, and also the resource mobilization for equality and social justice. And basically, you know, you have already mentioned how the topic of inequality and of social protection are key issues that will come up in the Finance for Development Conference in Seville, and also in the Second World Summit for Social Development. And just to start my presentation with conveying to you some of the results of a global consultation that UNRISD has actually conducted, asking people, respondents, you know, what are, in your view, the key social development challenges in current times around the world? And what are you asking, you know, from policymakers gathering in Seville and in Doha, what needs to be done, you know, as a matter of priority? And I think I'm lucky to be able to communicate that in this ranking, you know, of more than 500 respondents, inequality was the second mostly mentioned global challenge that we need to address. And in the ranking of, you know, what policymakers, you know, need to do and really need to move forward, social protection came in third. So we see, you know, that, you know, across sectors, ages, geographical regions, you know, people are very aware, you know, of you know, the importance of addressing inequality, and also the, you know, that social protection is a very powerful tool to address it. So in my presentation, you know, I will kind of further develop a couple of the themes that Shahra has already mentioned: why inequality is bad for economies and societies, what are, you know, root causes of inequalities and what we can do about it. And then I will delve in a little bit into, you know, financing and social protection policies, but also, you know, a final outlook on, you know, how we can actually harness the Sevilla conference and the Doha summit, you know, to putting social development and social protection at the center of our debates. Sorry. So from an economic point of view, Shahra has already mentioned a couple of, you know, arguments, but inequalities reduce growth, inclusivity, and are an obstacle to poverty reduction. You know, they're very bad for productivity and human capital, domestic demand and markets, quality of institutions, state revenues, but also, you know, the broader issues of social cohesion and equal living conditions, you know, in a particular context, and also, you know, very negative for environment and climate change. But something that is maybe not you know, mentioned very often, but still a very lively debate in academia and civil society is, you know, that inequality really is a key challenge towards our social contracts. You know, polarization and divisions, you know, that are the result of inequalities undermine solidarity and commitments to public policy. You know, we see sentiments of unfairness and injustice rising, which undermines credibility and legitimacy of political systems and institutions. This can lead to political radicalization or apathy, and also a very, very concerning impact of inequalities is that we very clearly see how it has an impact on the political sphere and leads to policy distortions and bias. Now, Shahra asked me specifically also to say a little bit about the interlinkages between inequalities and crises. And UNRISD has done an important report on this particular topic, because what we noted is we often speak about the poly crisis. Everyone knows that our world is characterized by multiple and interlinked crises in the economic sphere, the climate crisis, social crisis, political crisis, and of course, we have been emerging from a very severe COVID-19 pandemic. Now, what we found out is that it's not only that these crises often reveal inequalities, because a crisis is always harder to take, and harder to respond to when you're a marginalized person, when you are a low-income household, or when you're a business, a small-scale enterprise. That everyone knows. So often we see that crises actually increase inequalities, lead to greater concentration, lead to rising poverty rates. However, what we are not so aware of is that inequalities are also a key factor of instability. And so we have this vicious cycle, of inequalities leading to crises, and then crises increasing inequalities. And we have seen it very clearly in the financial crisis in 2008 and 2009. We see it in when we look at the climate crisis, especially the more concentrated income and wealth, and also in the corporate sector, we see that this leads, to higher emissions. In terms of the care crisis, it's important to look at state retrenchment and gender inequalities, which are very clear drivers, of this crisis of care. I have already talked about, the interlinkages with political crises, and we have been, very aware of the role of inequalities during the COVID-19 pandemic. Of course, you can look at the details, in our report, and I will put the link in the chat afterwards. But I also wanted to talk a little bit more broadly, about how we approach and understand inequalities. We can have a very technical approach and, look at economic inequalities and also horizontal inequalities. But it's very important to understand that it's multidimensional, cross-cutting, and a very complex issue. It has multiple drivers in economic, political, social, and cultural spheres, and very often it is rooted in history. And we see inequalities as legacies of exploitative and oppressive systems, such as slavery, colonialism, imperialism, extractivism, systems that are often underpinned by patriarchal or racist worldviews. Now let me go a little bit, through the how economic, social, and political inequalities have evolved. So Shahra already mentioned that, we have seen a rise in income and wealth inequalities, but also, in kind of economic concentration in the market during neoliberal globalization. And it's also important to see that this concentration of economic resources, is the root cause of unequal, power relationships and elite domination. When we look at social inequalities, which are along the lines of group characteristics such as gender, race, ethnicity, or caste, age, disability, citizenship, or other characteristics, again, this goes back, to social hierarchies that are often reproduced by applying discriminatory rules and practices. However, these social inequalities are also becoming much worse when they intersect with poverty, which leads, to social groups that are very marginalized and vulnerable. And finally, the political inequalities and power asymmetries drive and are driven by social and economic inequalities. And here we are talking about, how basically this concentration of economic power then translates into political bias. And we see in research that in many countries, actually public policies are benefiting disproportionately the affluent citizens, much more than the average citizen. And of course, this is a big problem when we talk about political legitimacy, credibility, and trust in our societies. That said, there's a lot that we can do about inequality. It needs to be comprehensive, as was mentioned. There's not just one policy instrument that can address inequalities. And in our research, we really try to map, the many policy areas that can help us to reduce, these intersecting inequalities, whether it's in the economic, social, or political sphere. And as you can see, of course, universal social policies, labor market and employment policies, and fiscal policies are clearly in this list of instruments that we can use. So if I just, say a little bit about, social policies and social protection, it's important that we realize, that only very universal and well-funded systems can actually play a role in reducing inequalities, improving gender equality, and also contributing, to growth, and protecting people. So, when we talk about social protection, I think, we all agree that we need this very comprehensive approach. But, of course, we need also a fiscal contract that underpins these social expenditures. And this is what we call, in a way, a fiscal contract, because, the fiscal contract makes very clear, that there is a give and take, and that if people are paying taxes, and often, I mean, the large amounts of taxes are coming from the broad masses, from the lower middle classes, from employees, and even people in the informal economy pay taxes and fees. So they want something back for it. And, they want basically that governments deliver on the social contract. And one key way to do this is, of course, to invest in social services and social policies. However, of course, we need to also take into account the global international financial architecture, because a lot of countries are spending too much on debt service, or they are losing a lot of tax revenue through tax evasion and tax abuse and illicit financial flows. And now I'm just coming, to my last slide, with some thoughts on, how we can actually build momentum now for Sevilla and the Qatar summit. And I think, inequality reduction must feature prominently at both summits. And we already have basically I'm sorry, I have to switch off my clock. I'm over time. We already have it featured in the zero draft, of the Finance for Development, and we are now in conversation with the co-facilitators of the World Social Summit, and inequality must really feature there prominently, and we need this consensus, which we will see, whether there will be a consensus among member states. We need to bring in universal social protection and fair financing policies, but also we need to really address, our economic paradigm that underpins, these growing inequalities and social exclusions. So I think, this is also something that we need to bring into these debates. We talk about finance, we talk about, social development, but we need to talk about economic policies, because they determine a lot what is possible. And finally, politics matter. We are living in a context where social contracts are under threat, crises, backlash against human rights and multilateralism, and we need these strong alliances that were also mentioned already, accountable institutions and democratic governance. So very much looking forward to the debate and the discussions here at the webinar. Thank you.
Thank you very much, Katja. I think that was a really comprehensive picture that you gave. I think in particular, I'm going to pick up on the point about inequalities. Not only do crises reveal the inequalities, we saw that during COVID, those who had access to social protection and those who didn't, those who could telework and those who couldn't, etc. But also very importantly, the way in which that many often crises are also themselves coming out of the instability and the forces unleashed by existing inequalities. Second point, I think you raised this importance of history. Countries are coming out of very different histories, and the reality of colonialism, of extractivism, of imperialism shapes our politics, our economics, our societies. And that's something which, we don't all start from a tabula rasa, and that history is always there in recognizing how that shapes existing inequalities that are very difficult to sometimes to address. And then that there's no magic bullet, and we really need to get the many different areas of policy right in order to be able to have the multidimensional kind of attack on poverty from different policy angles, using different policy tools. And also, very importantly, I took away the point about the fiscal contract. That also lies at the heart of any social contract, and of rebuilding a kind of trust between states and its citizens and residents, that there needs to be that give and take. People are willing to pay taxes, make social security contributions, if they have trust in the system being able to be there for them when they need it, in the form of, reliable systems of social protection, good public services, and so on. I think you've laid out the picture, quite comprehensively. With that, I want to turn over now to Sudhvir. It's great that you're with us and your camera is already on, Sudhvir. And I really want to pick up on the issues of looking more specifically at the role of investments in social protection, and why, you're coming from the WHO, why you see this as being very important in terms of promoting health equity. And I think it would be great if you could share some of the insights from the World Report on Social Determinants of Health Equity that I know you're very much involved in at the moment. So let me leave it to you, and you have your 12 minutes. Thank you.
Great. Thanks so much, Shahra. Lovely to be here. Always a pleasure to be working with colleagues from ILO, UNRISD, and socialprotection.org. And it's great to be here on behalf of WHO, because as someone concerned about improving health and health equity, economic inequalities, social protection are very much right at the heart of that. And over the next few minutes, I will give some insights and reflections as to why. So if we go to the next slide, please. It's always good to start with some definitions. So first of all, it's important just to reflect on how our health is determined by much more than just genetics, healthcare, or personal choices. In fact, the majority of our health outcomes are actually determined by the conditions in which people are born, grow, work, live, and age, and the political, cultural, social, and economic systems that shape these daily living conditions. And together we call these the social determinants of health equity, often known as the causes of the causes. And health inequalities are the measurable differences in health between different population subgroups. Health inequities are when these differences are considered avoidable and unjust. So when we are talking about achieving health equity, it really means being very purposeful and deliberate about removing the unfair and avoidable obstacles to health in daily life. And that means working upstream to influence these processes and systems and policies that stratify people in our societies. So if we go to the next slide, please. But as, well, in terms of WHO's approach to this work, we are about to work under a new strategy called the General Program of Work 14, which has been developed in consultation with member states and our partners. And it's really heartening to see that addressing these root causes of health inequities and these determinants is really prioritized in this new strategy. You'll see it there as the second of 6 strategic objectives in our upcoming General Program of Work. And likewise, our member states have really asked us for scaled up support to address the social determinants of health equity, including through asking for an updated world report summarizing the latest evidence and knowledge to inform policy recommendations. And I'll be presenting some insights from this report that will be very soon launching during this discussion. Next slide, please. And I think Shahra and Katja already mentioned it, but COVID-19 was just such a clear eye-opener that demonstrated the importance of social determinants of health, of inequalities in our society, to overall societal functioning. We have spent a lot of time looking at evidence. My colleague Nicole Valentine, with colleagues from multiple academic partners, including Tampere University, University College London, have done many reviews. And it showed that essentially social inequalities before the pandemic that caused inequalities in health contributed to the devastating nature of the pandemic that we experienced. And in the particular context of the so-called public health and social measures. So these are the non-medical interventions such as, stay-at-home orders, etc., physical distancing. The ability to actually implement these measures is very much affected by one's living conditions. So in practice, where there is high deprivation, household crowding, informal work, income insecurity, it's very difficult to comply with these measures that we're all very familiar with. Likewise, we saw that social protection was such an important buffer during the pandemic, but where there were gaps in rolling out social protection, those groups who missed out suffered disproportionately. If we can go to the next slide, please. So then in terms of economic inequality, Shahra and Katja have already shared some great insights, but just big picture, overall, economic inequality is associated with worse overall health outcomes, including reduced life expectancy, infant mortality, higher rates of metabolic diseases, and mental health conditions as well. And of course, we see an alarming association between economic inequality and health inequity. In countries where data is available, and that's actually a real problem, where we see a number of gaps that we're trying to work with partners to fill, but there is a remarkably close association between an area's deprivation levels and health outcomes, and there's a social gradient there as well. And as Katja was saying, we're seeing an unfortunate concentration of inequality, particularly within countries, and that seems to be getting worse. And we see huge gaps in social protection coverage, as my colleagues will elaborate on further. From our end, some insights from WHO, when we analyze the European Quality of Life Survey as one example, it suggests that for respondents in Europe, income security is the largest single contributing factor to self-reported health. And when you look at the difference between the most affluent and the least affluent quintiles in terms of their self-reported health, income security accounted for nearly a third of these health differences. This is followed by housing deprivation and educational outcomes, which are both also important social determinants of health. Next slide, please. And then in terms of social protection and health, again, overall, higher public spending on social protection, a fundamental social determinant of health, is associated with better population health. And there are a number of examples of this. We'll go through some of them during today's webinar. Here are some examples on the slide here. For example, our colleagues in the WHO Euro office have analyzed that implementing scaled up social protection coverage can result in a reduction in health inequities that is measurable within 2 to 4 years. So within one political cycle, you can see already tangible improvements in health. Likewise, there's been huge amounts of economic analysis done on the return on investment in social protection policies. And we'd like to just really encourage the factoring in of the health and health equity co-benefits into these types of studies, because they are very impressive indeed. Next slide, please. Another piece of analysis from WHO predicts that by eliminating wealth-related inequality in under 5 mortality, so that is by decreasing national mortality to the level that we see in the richest 20% in each country, we could save the lives of 1.8 million children in lower middle income countries. Now, currently we have an alarming child mortality rate of around 5 million deaths before the age of 5. So almost 40% of these deaths could theoretically be prevented if we were able to address inequalities and make inequalities not so pervasive in our societies. Next slide, please. So WHO has long worked with partners on the interface between social protection and various health conditions, diseases, and programs. Here are some examples of our guidance. There's a lot of work done on tuberculosis and social protection, a lot of work done on COVID-19, as I presented. And we look forward to continuing to work with partners on scaling up this kind of guidance and evidence and policy support. And one tool we have is this upcoming world report that Shahra kindly introduced. If you go to the next slide, please. And this report has been 4 years in the making, and a huge amount of evidence review, consultation, expert convening. And the first action area out of 4 for the World Report is really focused on the topic of today's webinar, on addressing economic inequality and investing in universal public services. Next slide, please. Here I'm giving you just a little preview of the 4 action areas there in each corner and the 14 recommendations that are about to come from this report. I'll just briefly walk through some of these because they're very relevant to today's topics. So you go to the next slide, please. So under this paradigm of addressing economic inequality, we have clear recommendations in terms of the importance of taxation, particularly progressive taxation, to fund and invest in universal public services, as well as helping address economic inequality. We talk about the context of development financing and some of the alarming figures around debt relief and how many countries are suffering from debt distress, where they're paying more in debt repayments than they are in health, education, and social protection, which is no recipe for addressing the social determinants of health. We talk about the importance of evaluating and addressing what we call the commercial determinants of health, the role of the private sector in health, and that includes really the public sector really standing up and addressing conflicts of interest, but also setting good standards in terms of working conditions, in terms of public procurement that shape markets beyond the public sector as well. And here we have our keystone recommendation on expanding coverage of universal social protection, which I'll come to shortly. If you go to the next slide, please. To just briefly cover some other aspects of the report, the main message is that inequality and social protection are key cross-cutting themes. So the next part of the report will talk about the importance of tackling structural discrimination, the importance of addressing determinants in the setting of conflict and emergencies, and we know that social protection has a fundamental role there. Next slide, please. We also have a major focus on how we can wrestle with some of these mega trends, such as climate change and the importance of climate action, as well as digitalization and how that's impacting the access to health and social services, and also posing a lot of risks, for example, in the world of work, and how we can mitigate those risks and address and improve health equity. Next slide, please. And the last part of the report really talks about bringing about change through new governance approaches. And here we talk about the importance of action at all levels, local government, community engagement, civil society. We also talk about the fundamental importance of universal health coverage. And obviously that's been a key pillar in the interface between financial protection, health protection, and health benefits. And we're just now trying to then support that, build on that, and then extend that to advocacy and support for broad approaches to social protection in general. We're also trying to really support the primary healthcare approach and the interface that allows between health and social sectors. And finally, the importance of monitoring and data and using that data to inform policy action. Next slide, please. So just going very briefly on the keystone recommendation, informed by a lot of evidence from the partners on today's webinar, that we are saying there's a fundamental action for member states to address health equity. We need to increase the comprehensiveness and expand coverage of universal social protection systems across the life course. If you go to the next slide, please. So in terms of next steps, we look forward to shortly launching the report. We're looking at a May launch, and then really beating the drum and getting the report into the hands of policymakers and sparking dialogue. In particular, we're looking forward to working closely with the partners on today's webinar, ILO and UNRISD, to go deeper on this social protection and health equity interface. So we'll be producing a dedicated policy brief together in time for the social summit to really amplify the evidence and the key messages here as well. And we look forward to overall much more joint work across WHO, ILO, UNRISD, and our partners to really build on each other's entry points and strengths. I mean, from our end, you know, what the work on social protections is so fundamental for health equity. We'd like to see that captured, that link between social protection and health really emphasized. And we also want to work with our colleagues in the health sector to make it clear to them that they should be working on and advocating for expanding universal social protection coverage because of its benefits to health and health equity as well. With that, I'll stop there. So thanks so much, Shahra, for bringing us together and looking forward to the discussion.
Thank you. Thank you, Sudhvir, for your very interesting presentation. I think we're all looking forward very much to the launch of your global report. Many points that you raised, I think, are reinforce some of what we had heard from Katja. Looking at social inequalities, before the pandemic, this was something that really contributed to the devastations that we saw as a result of the pandemic. So addressing those root causes, structural determinants of inequality being key. Also, very importantly, I took from the research at WHO Europe, income insecurity being the single largest contributing factor to self-reported ill health. And addressing income insecurity, I take it, again, is something that we can do to improve people's, at least, perception of good health, self-health. Investments in social protection systems improves population health and reduces health inequities. And within a short time frame, 2 to 4 years. So great investment for any government to do and see the rewards of it within a very short period of time. As one of your colleagues once said, social protection is as powerful a vaccine as you can have in order to improve health outcomes. And we look forward very much to working with you, working with UNRISD in terms of reinforcing each other's messages, in terms of what an agenda that really addresses the root causes of inequality must include. You both referred also to the fiscal side and to the fiscal pacts that are needed, as Katja put it. You highlighted also the role of progressive taxation, but also we cannot only pretend like countries are a little island unto themselves. We have a global context that at the moment, the way it operates, it's quite debilitating. The debt crisis is something that countries are now paying very dearly for, and it takes away resources that they could be investing in all of the areas that are dying out for investment, social protection, better public services, climate action, and so forth. So with that, I'm going to now turn to my two colleagues, to Helmut Schwarzer and to Umberto Cattaneo. But first, I'm going to start with Helmut to present some of the elements of our paper, looking at the social protection expenditure side, what the role of social protection expenditure can be in combating inequalities. And then I think Umberto will follow with looking at more the resource mobilization, the revenue side, and how that can contribute to the same issue of combating inequalities. I hand over to Helmut now, I believe.
Yes, thank you so much, Shahra. And thanks to socialprotection.org for this webinar, for helping to organize this webinar, and greetings to Katja and to Sudhvir from UNRISD and WHO. We are not going to speak much about the concepts behind, because they were brilliantly presented by our predecessors, and also Shahra in her introduction also mentioned to a large extent the first part, so the first chapter of the paper, which looks at the recent global evolution of inequality. What we want to do, what Umberto and I plan to do here, is to quickly present some findings of the empirical part of this paper, Combating Inequalities, What Role for Social Protection. And I would also like to mention here our thanks to Andrea Visentin, who is also part of the audience and who is also a co-author. So before going to the empirical part, just to mention that, we in the ILO, of course, we are an institution which is strongly mandate oriented, or of course we are completely mandate oriented. So the constituents of the ILO give us a mandate, and the first mandate that was given to us was in 1919, when the ILO was created as a consequence of the Treaty of Versailles after the First World War was over. We were given in our constitution the mandate to promote social justice in the world of work, and by extension also in the world of social protection. More recently, at ILO level, at international labor conferences, which are the let's say the highest moment of when our constituents deliberate and give us our tasks and our missions. In 2019, in the Centenary Declaration, so 100 years after the ILO creation, social justice and inequality also featured very prominently. And more recently, already under our current DG, Gilbert Ongbo, a global coalition for social justice was launched, which has this important dimension of fighting inequality as well. Well, looking at the empirical part, what we see is that different from that alleged trade-off between equality and efficiency that had already been mentioned, we see that the countries rather that allocate a higher proportion of GDP to social protection, they show greater equality. Hence, there is an importance to look closely at the relationship between social protection benefits, its financing, and the impact on income inequality. And that was what we wanted to do with this, with the second part of the paper. And well, indeed, I already kind of advanced the conclusion. The evidence that is presented in the working paper supports the argumentation that social protection is an effective tool to reduce income inequalities. So in this graph, we see the sum of redistributive effects of taxes, social security contributions, and social protection monetary benefits. Perhaps a few words about the methodology. The empirical part of the study was produced by using the Luxembourg income study microdata to estimate the partial redistributive effect of the social protection benefits, the monetary benefits, the impact of taxes, and the impact of contributions on monetary inequality. The least data sets are a very large income database of harmonized microdata. They cover 53 countries. And a certain limitation of these is that there is a rather limited coverage of developing countries. The methodology that was used in the study aims at obtaining the reduction in income inequality caused by each social protection benefit separately, as well as the effect of taxes and social security contributions. So we use the Gini coefficient as a measure of inequality. The transfers which were analyzed are contributory and non-contributory pensions, family benefits, unemployment benefits, sickness and employment injury benefits, as well as disability benefits. Well, in this graph, we see that from 52 countries, so almost half of them, 25, have a relative redistribution effect of 30% or more. In the graph, it is from Estonia to the left. And another 9 countries, from Lithuania to Switzerland in the graph, present a redistribution effect between 20 and 30. So it is a sizable, it is a respectable redistribution effect of social policies. Countries with higher impacts are those that have a more extensive welfare state, higher levels of social protection coverage, and also of social protection expenditure. Then in the next slide, we see the simulation of the specific impact of contributory pensions, and maybe not as much as a surprise to us, but perhaps as a surprise to some of the persons, because contributory pensions have actually often been treated rather as fiscal problems and not necessarily as redistributive tools in the mainstream discussion. For certain, they have been treated rather as a problem than as an important tool for the social cohesion. What we see here is that in 18 out of 35 countries, from Lithuania downwards in the graph until Hungary, the pensions, the contributory pensions, reduced the Gini coefficient by more than 15%. Czech Republic, Poland, Serbia, and Hungary by even 30% or more. So this result for us, it is not surprising because contributory pensions are often the most important social protection benefit. They, both in terms of duration and size of the benefit itself, and also in terms of the budgets that contributory pension systems or schemes have in comparison to the rest of the public policy budgets. So what we see here is then that even if there is such a large reduction in income inequality resulting from the spending, there is not a one-to-one relationship. It's not a linear relationship. You see that if you compare the left-hand column with the right-hand column, there is not necessarily a linearity. There are countries that have similar or close impacts in terms of redistribution, but with different levels of expenditure. And you may even compare that also, you may even make a comparison of how contributory pensions of, for example, non-contributory pensions have impacts on inequality, and there are not necessarily linear effects. So this is explained by the fact that the design of the pension system influences and the management of public finances in each of the countries is also of extreme importance, among other reasons that explain the differences in terms of the impact. Next slide, please. On the left side of the slide, we see the calculations that were done for non-contributory pensions, which are usually also very important budgets in terms of expenditure. And you see that there is as well a substantive impact. Perhaps not that much as the contributory benefits, because in many countries, non-contributory benefits are not as big in terms of expenditure. But you see also that those countries that have that tend towards universal coverage of non-contributory benefits, that for example, Switzerland, Denmark, Georgia, have a higher level of impact on inequality. Then on the right side, you see the case for family benefits, as well as in the case of, well, in the following slide, we will see unemployment benefits and social assistance. The next slide, please, Umberto. And in these cases, we also see a relevant impact of the expenditure on the reduction of inequality. However, in all of these countries, in all of these branches and these countries, the size of the impact is proportionally less, because certainly also the size of expenditure and other characteristics of the benefit are not the same as the ones of the contributory and the non-contributory pension programs. So what we can conclude here is that those countries that have rather universal benefits and universal coverage are those who feature better in terms of impact on inequality from the social protection programs. And with this, I give the floor to Umberto for the following slides on financing.
Thank you so much, Helmut, for giving me the floor. With Helmut, you have seen an overview of the impact of social protection benefits on the reduction of income inequality. We now move to the other side of social protection, which is basically the financing of social protection and how the sources of finance of social protection benefit are reducing income inequality. And this analysis was possible thanks to the Luxembourg income study microdata. So in all the 25 countries with available data that are presented on the right of these slides, we see that income taxes lead to reduction in overall income inequality. However, there are two exceptions, which is Palestine and Ireland, due to the structure of their tax systems. And we also see in this slide that the reduction are much lower than the one observed for social protection benefits. We were seeing some reduction for public contributory pension of 20% of inequality reduced after the benefits are paid. We here are more around 5% in 14 out of 25 countries. And we see that in Germany, Finland, and Israel, income taxes generate a reduction in income inequality larger than 10%. Basically, countries with similar income tax revenues as a proportion of total gross income achieve different redistributive impacts. This is due to the different design of their tax systems. We see, for example, Finland that has a reduction of income inequality through personal income taxes of 10% and spends around 21% of total gross income. So receive basically this is a tax revenue is around 21% of total gross income. And we see that the similar tax revenues are observed in Sweden, and the reduction in income inequality is half. It's only 5%. So depending on the progressivity of the tax system, we have different impacts on the reduction of income inequalities. Here we have also calculated the reduction in income inequality stemming from the levying of social security contributions. Despite social security contributions are a crucial source of finance for social protection, and the main source of finance social protection in many upper, middle to high income countries that are represented in this slide. Their power in reducing income inequalities is quite limited due to the single rate nature of social security contribution. In some countries, such as, for example, Germany, social security contributions are actually increasing income inequality. We see the 1.8% increase in Germany observed in 2019. However, as Helmut has presented, public contributory pension in Germany more than offset this increase in income inequality that is observed, because they reduce public contributory pensions in Germany income inequality by 22%. We see on the right of this slide wealth taxes. So wealth taxes are not very much exploited by countries represented in the chart. This is visible in the red bars. We see that wealth taxes, which include property taxes, they actually represent a minor share of total gross income, ranging from 0.2% in Germany to 2.8% in Greece. Wealth taxes, especially property taxes, are usually structured around single rates, such as the famous taxe foncière in France, and they are not very progressive. Therefore, there should be a movement towards introducing more progressive property taxes. And also, let me remind you, the G20 Brazil initiative to tax the wealth of the billionaire, and we hope that the South African presidency will also do more on this initiative. Now let me conclude with some small with a slide on how we can maximize the inequality reducing effect of social protection. So first of all, we need to focus on ensuring universal coverage of social protection systems, and social protection systems must be anchored in legislation. This we have heard this already from Katja. And this is very crucial to avoid that social protection is seen only as something for the poor and not for something for all the population. So social protection needs to be for everyone, to have the political will to scale up investments in social protection. There is a need, as enshrined in recommendation 202, to pursue a two-dimensional strategy to expand social protection effective coverage, combining contributory social insurance mechanism with tax finance provision. In the chart at the right of the slide, we see that the strategy to increase social protection coverage can go into an horizontal dimension, meaning providing a social protection floor, and in a vertical dimensions, so higher level of coverage for those who have the contributory capacity to have social insurance. Then we also need to set short-term targets that are realistic. We have estimated the financing gap to ensure universal social protection, and we have contributed to the 4th International Conference on Financing for Development, FFD4, with these estimates. However, in some countries, especially low-income countries, African countries, the financing gap as a proportion of GDP is very high. So there is a need to invest a very high proportion of GDP to universalize social protection and ensure a social protection floor. Therefore, we launched a global call to action for increasing social protection effective coverage by at least 2 percentage points per annum. Just to give you a figure, for social protection cash benefits, this would mean in low and middle income countries to invest 0.04% of GDP per year, compared to 1.3% if countries would have to universalize in one go. So it's much lower and much more feasible, because in 52 countries, it was observed that between 2015 and 2023, this growth in social protection effective coverage by at least 2 percentage points per year was observed. And some countries actually were growing double this amount. There is also a need to operationalize this call to action to explore all available fiscal space options. Some of them I have already highlighted. For example, progressive taxation on personal income, but also on wealth and properties. And also there is a need to basically have an international framework that is conducive for unlocking investment into social protection. For example, there is a need to reform the SDR allocation because currently only 1/3 of the SDR allocation goes to developing countries, which are those are most in need. Then there is basically, before I conclude, I would like to mention...
So if you can please shorten so we can finish in 1 minute from now.
Sure, I will shorten. So there is a need to and maybe this will be more debated in the Q&A session, to think that social protection is one of the policies that reduce income inequality, but there is a need to integrate also employment, macroeconomic policies to reduce income inequality, and this cannot be left only to social protection. Thank you very much. Over to the moderator. Thanks.
Brilliant. Thank you very much to Helmut and Umberto for presenting the key findings from the ILO working paper, which you can also access. The link to it was provided, highlighting the effectiveness of social protection, both on the expenditure side in particular, in reducing inequalities. We saw some of the stunning figures on the impact of contributory systems, of pensions in particular, in reducing income inequality. And then some interesting figures figures about the financing side coming from both social security contributions as well as taxes, and the great diversity across countries. Not all expenditures have the same amount of expenditure has the same impact. Some systems seem to be much more effective with a given amount of expenditure to reduce inequalities much more effectively than others. So a lot of diversity at the same time. I'm very pleased that we still have at least 15 minutes for questions and responses. I would like to ask our panelists to kindly open their cameras so that everyone can see them. I want to ask Katja, Sudhvir, Helmut, and Umberto to have their cameras on. We've had a couple of questions, and I'm going to pick up on at least, let me just quickly pick up on, we had a first question about proxy means testing. And the question says that, so far proxy means tested social protection schemes are still the mainstream. I don't know if they're the mainstream, but it's prevalent around the world. And what the question is asking is, what are we missing in convincing policymakers to adopt a more universal approach? I think this is a very interesting question about the sort of political economy and why proxy means testing and narrowly targeted social protection is preferred in some contexts. And what do we need to really create, I think, that fiscal kind of contract that Katja was referring to, of having a more universal system, having more people contribute and also more people benefit. How do we make that transition? Maybe that's something which is embedded in this question, but maybe I can turn to Katja and then ask other colleagues if they want to come in to address this issue about what are we missing in convincing policymakers to adopt a more universal approach as opposed to a very narrowly targeted approach to social protection. Katja, maybe you can start the conversation and then others can come in.
Yeah, thanks so much. That's a really very important question. I just actually published an article, on that question together with Bread for the World. They have an interesting report coming out, and I called it, this insistence on what we call the residual social protection approach. The result of the power of ideas and money, basically. So, basically, having a targeted approach of poverty reduction policies, and that then often translates into targeted social policies, cash transfers, but also other type of, targeted social benefits, such as, public works or others. And, not to say that they don't have benefits, they can have very large benefits. It's part of the social protection floor. We greatly advocate to institutionalize and universalize these systems. That said, why do we continue with proxy means tests with this targeted approach? And I think, it goes very much back to where interests coincide. So on the one hand, we have actors such as donors or, UN agencies that work, with a project approach. So, in order to implement a project, you need kind of a defined time, you need a target group for it, you have a limited budget. So then channeling, this amount of money, to a time bound and also in terms of beneficiaries, specified group of the most needy, makes sense from this project approach. And that coincides often in low and lower middle income countries with an interest of governments to reduce public spending, to reduce their expenditures in social protection. So I think, this is, one of the main kind of drivers, that we still are operating in the international donor and development community with a project approach, and that we have a lack of fiscal space in global South countries, and these two very pragmatic reasons, then often lead to the implementation of these targeted projects. If we take a public policy approach, of course, that would be different. And if we think of the benefits of, having comprehensive and universal systems in the long term, we would take different decisions. But, And I won't go into, you know, the kind of theoretical or, you know, ideological underpinnings also of, you know, that are also often mentioned. But I think, you know, there are pragmatic reasons also for why this continues to exist.
Thank you, Katja. I have a few more questions, and I'd like to start, if I can, maybe with a question that's, maybe I can address this question to Helmut, given that it's about statistics and lack of data. The question is coming from our colleague Delia Boccia, and she's asking our colleagues from ILO, and I want Helmut to answer since he's overseeing the work on statistics, social protection statistics. What she's asking is, while universal social protection coverage seems a must for the future, there is a dramatic lack of data when it comes to social protection coverage among ill-affected populations, for example, people suffering from tuberculosis. So this is really about the disaggregation that we need. Despite the current financial constraints, is there hope that ILO may start collecting data for people affected by different diseases or support the health sector to collect these data in the future? I want to address this question to Helmut, and then I have a question which I will address to Sudhvir, and then one more question which I will leave it to later. But maybe, Helmut, first you want to come in on this data question, which I think is an important one.
Yeah, well, the ILO already does a big effort in terms of collecting data. We operate on a 3-year cycle. Maybe it's good to spend 1 minute explaining to our colleagues, to the participants of this webinar, how we do it. So each 3 years, we do a full cycle of updating of social protection information from our member states. So we have 187 member states, and of course, it's not possible to collect from all countries at the same time. So over a period of 3 years, we do this, and we use a tool which is called Social Security Inquiry, which is already quite complex. It collects information about the different branches, the different institutions that exist in the countries, the expenditure, the number of benefits, some historical information as well, expenditure, sources of financing. Not all countries answer everything, but more and more countries have been answering, have been completing these questionnaires. And for the last World Social Protection Report, we had 172 countries with completely updated information, and we had partial information for other countries, up to 212 countries and territories, in the world. So actually, there are only a few countries where we do not have at least some information which comes from. And so this is important because we are mandated to calculate the indicator 1.3.1 on coverage, effective coverage of Social Security for the SDGs. So we have not had experience in terms of collecting health data. It is a mandate of the World Health Organization. So we have been working quite well together with our colleagues from the World Health Organization on several of the indicators. So thank you very much, Sudhvir, here in public. We would like to really recognize that. I feel that the possibility, so the economic means to increase the number of data, the number of indicators, of course, it has a cost, and we run on a limited budget as all other institutions. So it would be perhaps unrealistic to promise that we would go into detail in many other dimensions. So I think that this needs to be built progressively in collaboration with other institutions, especially with the WHO.
Thank you, Helmut. And if I can just say, Delia, a small addition to what Helmut said. I mean, even something very basic as having the coverage data disaggregated by sex, it's not as easy as one thinks when the data is not necessarily being provided in that form through the countries that are providing the data don't actually have the sex disaggregation. It's I think this last World Social Protection Report was one of the first where we did have more data disaggregated by sex, and we did, I think, some interesting analysis, particularly on pensions, both contributory and non-contributory, disaggregated by sex for a considerable number of countries to be able to show the picture. So as Helmut said, it does require a lot of investment of time and resources, and also in particular when that data is not being furnished by the countries that are completing the SSI. But I hope that there can be a better collaboration, more collaboration with the data producing units and divisions in the WHO to be able to address the kind of question that you asked. And maybe I will turn to Sudhvir now with a question from Christina Berendt. She's asking, as well, very interesting, she says, to see the significant impact of income security on health outcomes that you presented, Sudhvir. Could you elaborate more, she's asking, on the channels through which income security impacts health outcomes, including, we assume, mental health has an important role to play here? And what do you see as the key policy recommendations based on the evidence that you have for the design and financing of social protection systems based on these results? Over to you.
Thanks, Shahra. Thanks, Christina. Excellent questions. And I think these mechanisms are a really important area of research to inform policy action now, because we see the associations, we see the patterns, they're repeated. But then the question is, how do we really focus on the interventions and break that cycle? I think a number of mechanisms come to mind in terms of income security and health. The first is stress. So just that uncertainty and what that does to someone's biology. There's a lot of interesting, I won't go into it now, we don't have time, but there's a lot of interesting biomedical research on what that does and how that affects various physiological processes over time that leads to earlier onset of diseases, both physical and mental health. The second is perhaps more psychological, but it's fear. It's that manifestation of uncertainty and how that affects decision-making and health behaviors. And then it's material hardship as well. So they're not being able to have the income security to afford the foundations for healthy living. For example, nutritious food. We see a huge association between income insecurity and hunger, and that then leads to health consequences. We also have evidence on, which, when we look at different types of social protection benefits and then what type of mediators and what type of consequences they have, for example, on food security, for example, on child benefits and access to quality education. So it's a bit of a jigsaw puzzle, both on the mechanism side and on the impact of the intervention side. And we're increasingly putting together the pieces with our colleagues here to try to really, focus attention. But big picture, we know that income insecurity is a major driver of ill health. So the fundamentals are there in terms of increasing social protection coverage, as we've been hearing about, and overall just rebalancing power in our societies, addressing some of the root causes that we've discussed here in terms of progressive taxation. And then as part of that, we have to be considering governance in terms of giving people experiencing income insecurity, experiencing marginalization, a greater voice. And having a greater say in decisions pertaining to them as well. So it's a very interesting and complex area, and I'm glad you raised the question. Thank you.
Thank you, Sudhvir. And if I can just add one point to that, one of the issues that, ILO obviously is always insisting on the importance of having social protection systems that are legally anchored. And this gives a certain amount of reliability. You can rely on those benefits as opposed to these very ad hoc cash transfers that come in and then disappear. So I think that also I haven't looked into your research, but I think that issue of reliability of a system must also make a difference in terms of people actually, having a sense of security, because that if you're on a pension system and it's legally anchored, no matter what, you get that pension every month. Whereas if you are relying on a cash transfer, it may come today and then there's a change of government and the scheme or the program may disappear. So I think that important area of reliability, important criteria of reliability, which is a strong one in international social security standards, is also very important in creating this sense of security and hopefully producing better health outcomes. So something else to consider. I have a question which I want to address to Umberto. And there are actually two parts to the question, and in interest of time, I suggest you pick one of them. The question is that we have heard about inequalities are being multidimensional, but most of the time inequality is measured only with the income criteria. How can we make sure that we capture the full spectrum of inequalities? That can be a separate question. So one thing is about multidimensional, perhaps multidimensional poverty, income being one dimension, but there are others. And then the other one is also about different kinds of inequalities, including the question is asking about intra-household inequalities, gender inequalities being important inequalities within the household, and how difficult they are to capture with microdata. So maybe you pick up on one of these issues, Umberto, in the interest of time, because I have one more question from one of our colleagues from South Africa that I will leave it to anyone who wants to come in to respond to that. But over to you.
Thank you, Shahra. I will pick the first part on multidimensional inequalities. There is a need to complement the usual measure of inequalities, which is income, with inequalities on the functioning of each individual. This is in line with the Amartya Sen capability approach. So functionings are, for example, the capacity of an individual to access health care when this person needs it, or the capacity of an individual to move when this person needs to move, move from one place to another. And if there is hope around that, because in paragraph 55 of the FFD4 first draft, there is a stress on going beyond GDP and beyond income. And I think if this paragraph would also be framed around inequalities would be great, because this would mean that we will be able to complement the usual Gini coefficient, Palma ratio, with something that goes beyond these indicators that are often measured at the household level, and they often do not capture intra-household inequalities, which are very much present, especially in low and middle income countries setting. Thanks. Over to Shahra.
Thanks very much, Umberto. And I'm just we have maybe one more question. Maybe whoever wants to come in, but please to be short. We have heard, it says that South Africa dominates as a welfare state in Africa. How representative is South Africa to the portrait of social protection systems in post-colonial Africa? Maybe you can comment either on that or just say something about the second part of the question, which talks about the informal social protection, which even though it's ubiquitous in the global South, it's largely trivialized in policy frameworks and in research. So either you want to pick up on the point about informal social protection and what you think about that, or maybe say something more broadly about South African sort of welfare system and how far it's representative for the continent. I don't know if I have any volunteers who would like to come in to respond to that question. We only have like literally 1 minute, so I'm looking to see. Great, Katja, please come in.
I'm just coming in on whether South Africa is representative in a way of the region. I think it's important to acknowledge that each country has its own kind of historical legacies, which are often shaped by former colonial powers or also by the economic system. So I think South Africa is quite particular, but there are some other countries in the region that have similar conditions. But I think there are other clusters of countries, which have developed different types of social policies in response, to the historical, political, and economic situation, but also the particular approaches, in post-colonial, post-independence era. So I think, that said, I think it's always very good to learn, from each, country in a region. And I think South Africa is in many regards a pioneer on certain policies, definitely a pioneer in terms of its social development strategy and its extensive grant system. So, but, I think we can't single out one country in a region, but there are definitely clusters and we can learn from each experience. Thank you.
Thank you, Katja. And I see, Sudhvir, you also wanted to come in on
this. Just very briefly, I know we're running out of time, just to say two things. We are soon about to publish a case study on South Africa, social protection and health equity on our Global Knowledge Network for Health Equity webpage, which might expand on that. So I'll provide a link to that. And second, We're very encouraged by the South African presidency of the G20 this year, which is very historic. And we're very pleased to see this emphasis on health equity, social protection coming through in multiple tracks. And we're very pleased to be contributing a policy paper on the cost-effective interventions for pandemic preparedness and response, including through the social determinants of health, where social protection and South Africa's work on social protection will feature very strongly. So happy to follow up on that as well.
Indeed. Thank you very much, colleagues and friends. This really brings us to the end of our webinar, and we do want to salute South Africa for its presidency of the G20, and very pleased to see the way in which they have elevated the role of social protection systems and the ILO recommendation 202 on social protection floors. And we hope that we can get some strong messaging through the South African presidency of the G20 this year. We also are all looking forward to the financing for development outcome documents, in seeing strong messaging around reducing inequalities, role of social protection systems, public investments, addressing the global financial architecture that is not obviously working to the benefit of many developing countries, and the need for serious reform of that architecture, as well as the need for greater national dialogue and participation, role of social partners in really creating that kind of social contract with that fiscal contract at its heart that can really make economies work for people and make sure that economic dynamism, economic growth, productivity delivers for people, not an economy where whatever productivity and growth we see tends to trickle up to the few. With that, I want to thank our socialprotection.org colleagues for having hosted us and enabled this webinar. I want to sincerely thank Katja, Sudhvir, Helmut and Umberto for their time, for the presentation, and for the whole socialprotection.org team that behind the scenes have been working very hard to bring us together. And thank you, the audience, for having patiently sat through this webinar. Thank you for your questions, and I hope you have taken some useful links and lessons out of the webinar that you can use to make use of the messages and the policy and research findings that you have heard. The last question that we had was about how we can inform youth to become agents of change. I think that's not a very easy question to answer. But what we hope is that the research, the policy messaging can be made accessible in a way that everyone can use, including young people who have obviously a big responsibility to pay in shaping the world that we live in as we move forward. With word of thanks to all of you, thank you very much. And please make sure to answer our survey, which is available when you leave the session. This is a message from socialprotection.org, and join us for the next webinars. Goodbye.